This recorded review will be going over MedSurg 2, Exam 5, Study Outline Review. This exam has 0 select all that apply questions. No nursing implications for a clean catch midstream urine specimen in Table 33.2, page 795. It would be a good idea to refresh yourself on the steps of this skill in your fundamentals textbook. You can find this on page 555. And there is a blue patient teaching box that goes over the midstream urine specimen collection. Table 34.1, Drugs for UTIs, page 813. You should know the nursing implications in patient teaching for nitrofurantoin. Check out the purple clinical cues box about the 24-hour urine collection on page 794. Check out the red older adults care point box on page 811. Patients recovering from cystitis should avoid caffeinated beverages. Read more on page 811. Acute glomerulonephritis. Know the nursing management and treatment. Take a look at the blue patient teaching box on page 815. Potassium-sparing diuretics. You can see these in Table 9.1, page 137, Evolve Introduction to Pharmacology textbook. Be familiar with the names of the drugs within this class and their nursing implications. TURP. You can find this in Table 40.2, page 958. Know the postoperative care for a TURP on pages 957 to 958. A couple questions on this. When caring for a patient with continuous bladder irrigation, or CBI, it is important to adjust the flow rate of the irrigation fluid so that the urine is light pink and eventually becomes clear. There is a question on being able to read the pH, CO2, and bicarb to determine whether or not there's acidosis or alkalosis and whether it is respiratory or metabolic. Please refresh yourself on the normal ranges of pH, carbon dioxide, and bicarb. I have stated them in previous study outline reviews for this term. Know the signs and symptoms of BPH, page 956. Chronic glomerulonephritis. Know the diagnostics and labs that are needed to confirm the diagnosis, page 815. Suprapubic discomfort could be an indication that a patient requires intermittent catheterization. Check out the purple clinical cues box on page 958. Serum creatinine diagnostic test. Know the purpose of this test on Table 33.2, page 796. Be familiar with your normal ranges for BUN and creatinine. You can see these on page 796. Understand that a normal hematocrit value for a male patient is 40 to 54%. Know the diagnostic lab values for acute glomerulonephritis, page 814. Know the signs and symptoms of pyelonephritis, page 814. Understand terminology related to urine output and flow. See this in box 33.2, page 801. Know the signs and symptoms of chronic renal failure, also known as end-stage renal disease, also known as end-stage kidney disease. These 3 terms are all referring to the same thing, renal failure. Check out the signs and symptoms on page 827, and also be familiar with the diagnostics and labs that you would expect to see. Treatment and nursing management for urolithiasis. These are stones, page 819. Table 33.3, page 800. Common causes of variations in urine color. Take a look at the purple clinical cues box, page 802. Understand what CAPD is and be able to explain that to a patient, page 832. What foods contain high amounts of purine? You can see this on Table 34.2, page 817. Patients should be instructed to take a laxative the night before a scheduled intravenous pyelogram, or IVP. You can read more about this on page 796, and you should also know the nursing implications for an IVP. Know the nursing implications in patient teaching for peridium. You can see this in Table 34.1, page 813. Know the phases of acute kidney injury, or AKI, on page 824. Focus on the oliguric phase. You should also know potential causes of AKI on page 823. Check out the blue patient teaching box about preventing UTIs, page 811. Know that hypo and hyperkalemia can place a patient at risk for cardiac dysrhythmias. Check out box 9.1, page 138, Intro to Pharmacology textbook for foods high in potassium. Sodium polyestyrene, also known as Kayexalate, will be administered to correct hyperkalemia. Know the nursing management of urinary incontinence. This is over pages 806 to 807. Pay particular attention to bladder training and toileting schedule. Loop diuretics. You can see these on table 9.1, page 136, Evolve Introduction to Pharmacology textbook. You should be familiar with the names of the drugs in this class, as well as their nursing implications.